Let's shift gears and talk about the unspoken battles. Outside of the operating room, you also have to fight the system, the insurance companies, I would suppose. A lot of red tape to deliver that proper and necessary care for the patient.
I'd say there are a couple of common situations. Okay, patient comes to the office. They have an injury. Let's say it happened at work. And they say, I had a slip and fall at work. I was carrying a pot of soup at a deli and I slipped. And this is a common example. Patient said, I work at the deli carrying a pot of soup. Someone had spilled soup before me. I slipped and fell and I injured myself. And I say, okay, let's get you started. You need imaging because you've got findings of radiculopathy on exam. You need medication. You need some work restrictions. You need to get started in therapy. Let's figure out what's going on. So in that room, I've got myself, the patient, and we're just treating as we treat. Now, there's a whole world outside of that room that I'm not privy to necessarily, and that adversely affects the progress of that patient through the healthcare system. So what do I mean? So I treat a number of patients, some of whom do not speak English as their primary language. They might speak Polish or Spanish or another language. And some of the common problems that we run into, there are some from an employer perspective. And you say, like, what are those problems? And I'm not privy to these at the beginning, but they become apparent later on. And I have no way to control them. So this is common. And you'd say, 2025, how can this be common? One common occurrence is that employee has been being paid in cash and is off the books for that employer. That patient has a witnessed fall at work and then says, an ambulance took me away, a witnessed fall at work. And the employer said, that patient never worked here. And then they said, well, all these 3 workers witnessed me falling. And those workers who are living in their own fear of job loss will say, no, that patient never worked here. And you'd say, is that really true? Is that possible in 2025? Yes, it's possible. I saw it this year. Another common occurrence, more common than you would think. Patient gets injured at work, has a fall. Employer maybe has workman's compensation insurance. Patient says, I need to seek care. Can I get a copy of the insurance? Employer pulls them aside and said, look, my premium will probably go up if I file a claim. And so just go to the ER, tell them that you fell at home, get the treatment, and then I'll reimburse you whatever's not covered. Well, from that employer's perspective, it may sound good. You may be saying, okay, that the patient's going to get treatment. It'll obviate my insurance premium potential increase, et cetera. But what ends up happening is, A, the medical record is inaccurate. And the patient will later come to me and say, oh, I had this injury at work. And now you've got a discrepancy in the medical record, which is not my fight to fight, but it is a barrier in terms of patient receiving treatment. And B, at some point, the health insurer that was being used to pay for the care becomes aware that this was an injury at work.
It's an insurance fraud.
It's insurance fraud. Exactly. Or the employer who is super willing to cover the bills on the day of the injury, when the bills actually come due, the employer's like, oh, I'm not willing to cover those bills. I'm sorry. And so there are, in 2025, instances that I've already seen where the employer presents a barrier to care. And then the other part is from an insurer perspective. Same situation of an injured worker. Let's say the employer shares the insurance information, patient comes in, and we say there's a need for care. Not everybody needs care, but some people need care, and we're going to go ahead and provide that care. Well, in Illinois, there's this utilization review process for workman's compensation. I might say, Greg, you look injured. You've got an L5 radiculopathy. You need an MRI. I'm a spine surgeon. I feel pretty confident in the fact that you've got weakness in your big toe and you've got a matching sensory pattern. And utilization review means that I will send this. The insurer invokes utilization review. And the utilization review means that they have to find any doctor with a license, often not in Illinois, sometimes in Illinois through licensed reciprocity, but rarely in Illinois, might be a retired family practice doctor or an anesthesiologist. And that guy says, doesn't meet ODG criteria, Sokolowski might be a spine surgeon, but it's 5 days post-injury. The patient might have a radiculopathy and a foot drop, but we're not approving the MRI. And here's the kicker. If I don't appeal that denial within 30 days, treatment ends. If the doctor misses that one fax of UR denial, now there's a huge barrier to overcome. So when I come to the office every day, I get UR reviews. Some are certified. They come off the fax machine in 2025. Denial of MRI, denial of physical therapy, approval of a medicine, denial of another medicine. And a significant portion of my time pre-clinically every day, I get there early, I review the notes, etc., is filing appeals, because if I don't file an appeal, the insurer says, okay, we have the opportunity for a blanket denial. We've invoked utilization review. And when you file an appeal, they're supposed to get a doctor of the same specialty as you to review the case. Okay, 2025, doctor of the same specialty as me. Who's reviewing it? Retired 83-year-old orthopedic surgeon in South Dakota. And you'd say, no way, that's crazy. How can that be? Yes, that's who is doing the appeal. Second is, I'm a spine doctor, right? And so let's say you fractured your tibia. Okay, there's no ambiguity. You get tibia fracture. It's hard for someone to deny that tibia fracture is there. Radiologist has read it as a tibia fracture. It's hard for someone to say, no, there's no tibia fracture, right? So it's hard to do a denial. Well, in spine, you can have a disc herniation. Let's say you've got a disc herniation L5S1. Company can send you for an independent medical examination with a doctor. And that doctor can say, yeah, that disc herniation's there, but it's likely pre-existing. Care denied. And now, because someone can say that it's likely pre-existing, you now have another battle to fight with the insurer. And that's a battle that I'm just the doctor. I just write the notes. I say, really, no, Greg has an L5 radiculopathy. He tells me temporally he didn't have a drop foot yesterday. He had this injury at work. He now has a drop foot. He's got new numbness he didn't have yesterday. He never had an MRI before. It seems to me that it's not pre-existing. So I just write my, response. No, I think, it shows I respectfully disagree with Dr. So-and-so, whatever. But if that patient doesn't have someone fighting for them beyond the scenes, beyond my scope, that patient, the doctor might say, back to work full duty. And the patient's like, holy crap, I can barely do restricted duty. How can I go back to work full duty? So there are things that I can do in my clinic. I can treat you. I can get you a brace. I can give you an injection. Because I have a therapy clinic, I can start your therapy even before the documentation's in if you need therapy. I could give you a work note, but I have no control over the insurer UR process other than diligently filing my appeals and generating paperwork. And I have no control over what happens at that IME where someone can say, yeah, the radiologist read that as a disc herniation, but, probably pre-existing, or that disc herniation, or the patient had back pain 3 years ago before. Certainly, this is all a continuation of this pre-existing back pain.
You just said that those patients, they need somebody outside of the confines of your clinic to actually fight for them. And the question I get very often, and sometimes I get it too often, is the typical question, well, do I need a lawyer? Right? I had an accident, this and that happened to me, I'm treating with so-and-so, and do I need a lawyer? Well, I hope that whoever is watching this podcast or listening now understands quite well that there's a job cut out for everybody. For you, the surgeon, for the physical therapy place, for your primary physician, and there's a job cut out for the attorney. And everybody can only take it so far.